This will be the final issue of 2014. This has been a very good, successful year for ASJ. Our circulation has continued to grow. Our impact factor went up significantly, and our readership has increased. We owe all of this to you, our readers, our authors, our reviewers, our editorial board, and of course our editorial staff. We look forward to 2015 with a lot of new items. We will have a new publisher, we will have a new website, and many new changes and innovations to both the electronic and print version of the journal. For this final issue, I have picked two papers from the breast section. The first is from United Kingdom by Drs. Marcus Forza and his associates, tackling the very difficult problem of the infected breast implant. They successfully treat 17 patients with infected breast implants without removing the implants. They outline their treatment, and it's impressive to see that they were able to salvage all of these infected implants. The second paper deals with anatomy, and that's from Texas, Dr. Clayton Molliver and his associates. It's an anatomy paper, cadaver dissections, looking at the sternal origin of the pectoralis major and its relevance to subpectoral breast augmentation. I found it very enlightening and recommend it to all of us who perform submuscular breast augmentation. The next paper is in the body contouring section. It's from Dallas, Texas, UT Southwestern, led by Dr. Jeff Kinkle, where they describe their guest suites. These are not hospital beds, but they're a cross between a full hospital bed and a hotel room where there's supervision by nurses, and they show the value of the patient going from the recovery room into one of these suites. We have had similar suites in our practice for almost 20 years, and I cannot agree more with the authors, and I cannot emphasize enough the value of these suites, not only in terms of patient safety, but convenience and ease for the patients. In the research section, we have another paper from UT Southwestern, Texas, headed by Dr. Jeffrey Kinkle, looking at the question of prophylactic antibiotics and the need to continue antibiotics beyond the perioperative period. This is a very important paper. We should all study it, and based on the evidence they present, I would recommend that we rethink how we prescribe antibiotics and for how long post-op we continue it. The final selection is a case report, and all case reports in ASJ are online only. This, I feel, is a very important case report dealing with embolism into the internal and external carotid artery following autologous fat grafting of the face. The case report comes to us from China by Dr. Wang and his co-authors. I've chosen this because it's a word of caution. We have to be aware of the possible complications of injectables, and also I would recommend the very thoughtful and thorough discussion of this case report by Dr. Claudio De Lorenzi from Canada. So with the end of 2014, I wish all of you a great holiday season, Happy New Year, and and join us in 2015 for a lot of new and exciting things with the journal.